mix actually. Somehow I invite Dr. Sri Nagesh. Dr. Sri Nagesh is a plastic surgeon of repute. He has been in Hyderabad for a very long time and he has done really wonders. And Dr. Sri Nagesh would like to talk on something called lipedema. And Dr. Venugopal Gouri, please do join here. You have Dr. Srinivaslu Gadguji. Where is he? Dr. Srinivaslu is coming. And Dinesh Kumar sir, you have to come here. Dr. Dinesh. Dr. Srinivaslu Gadgu. Dr. Venugopal, he is like a brother to me. But somewhere he has worked out, he doesn't even try to come on the stage also. He is a very shy guy. Dr. Dinesh as well as Dr. Srinivaslu Gadguji. So I'll start with the people who are going to take less time. I'll start with them. You want to start?
I have no QR code. I have a surgeon.
You decide. We'll start with you. I give it a go.
Good afternoon, everyone. It's tea time, so I think it's not post siesta, so we still have something to listen about. And thank you to the host, Dr. Praveen Saxena ji, for having this wonderful event. So we call him during the evening times when we have a song and dance. सारे शहर में आप सा कोई नहीं. So I think you will accept that because he is the one who wants to bring all people together. And I'm a homeopathic physician practicing in Hyderabad for some time. And I'm a part of this Homeopathic Medical Association of Telangana. And we organize monthly events where we call reputed names of the Twin Cities and from all over. In fact, Dr. Digamashri, Dr. Mili Shama were on our resource persons panel for some time before. So that was how we came across Dr. Praveen Saxena sir, who had come and spoken about autism at our association. And when we come to a meeting of functional medicine, the best thing we come across is talking about the heavy metal toxicity, how you chelate them, and these are the prime things, and how you can supplement with nutrition to help the patients to come out of the issue. So the beauty of homeopathic practices or therapeutics is that we can incorporate many ideas. We can take new thoughts, apply the same old medicines, but still come out with a better result. And it's always an evolving science. Anything which is finite, which is closed, which has nothing more to offer, is not interesting. But not about homeopathy. As far as technology is advancing, science is advancing, everything you take ideas from that, still use it for therapeutics of homeopathy, it works. And our fine gentleman, Dr. Saxena ji, had spoken about vaccination, the likely cause of autism, and it will always cause a furor whenever you talk about it, but all the same, everybody knows the facts, and our duty is to do our best to get rid of them. So he was talking about the toxicity of lead, aluminum, and mercury that are likely causes of these things. They cross the intestinal permeabilities there, so they get into the blood stream, then they... Nothing much actually there, but yeah. Then they enter into the brain, whichever part of the brain that toxins are stuck there. All this has been spoken by Dr. Ashwini Garg and Dr. Shilpa Rauji in the morning with pathophysiology and pathology of autism. So chelation is the idea. That is what is the idea that we gathered from Dr. Saxena that evening. And the next day when I saw the first patient of autism, I thought I should try this. So we started with, we make medicine from mercury, we make medicine from lead, we make medicine from aluminium. And the good thing about homeopathic potencies is when you offer them in smaller doses, they can chelate, they can flush out the toxins. So I thought, okay, if I have to trust Dr. Saxena, then let me try this out. And in 4 weeks' time, I promise you, whatever may be the case, whatever may be the age of the child, of course we all know it is only between 3 and 4 years of age, the patients actually respond better when we, whatever kind of therapy we offer to them. So whatever may be the stage of the age of the patient, maybe 9, 10, 11, there is some response. I'm not saying they're going all the way to IIT after taking this medicine, but definitely we saw that at least there is a eye contact the next time when you see the child. And the parents will come and say, he's able to sit for some time now. Then they will say, he's, I think, somehow come into the world now. Let us see how it goes in the days to come. So, mercury, lead and aluminium. So we have mercurius solubilis, we call it 6C, alumina 6C and plumbamet 6C. Then again Dr. Saxena had spoken about zinc when it is enough in the body, as Dr. Sanjeev Sharma also was talking about zinc. So when there is a good amount of zinc in the blood circulation, it will prevent intestinal permeability. So we said, okay, let us try to assimilate zinc with our homeopathic medicines, and we also started with zincum metallicum 6C, which is a homeopathic potency. And definitely there was a better response. So that is how we came into the world of autism, incorporating new ideas. And I promise you, we have professionals from all streams of medicine, mainstream of medicine, Ayurveda, Unani, and also homeopathy here. I promise you, these are simple things. Homeopathy is an ideal partner in integrative medicine. We have something to bring to the table. We have something which can work as a complementary system of medicine, which will not come in the way of action of your medicine, which is not also going to have any impediment in the course of the treatment with any other system of medicine. I think that is the reason why we should incorporate. So the same thing, we have repertories talking about several medicine much before these things were always in our textbooks. It is only that we try to find them newly. In fact, Dr. Sanjeev Sharma ji had come a couple of months. Australia. Yes. Dr. Srinivas was there. This thing. So the other thing I just wanted to say was, we have homeopathic medicines made from the healthy parts of human beings, like organs, or it could be enzymes, or it could be hormones. So insulin produced by your body, when you give insulin in a 6 potency form, it can help in seeing that insulin resistance comes down. Especially in young girls with PCODs, we find that serum insulin fasting is high. And in such young girls, you give insulin 6C, in probably 4 to 6 weeks, you can see that things falling down. You can see the discoloration around the neck and all those factors which can cause the issue come down drastically. Then we have pancreatin. We have a lot of patients who have low serum C-peptide, probably needing insulin injections in the days to come. You can always try pancreatin 6C. Not that it is going to generate islets of Langerhans and produce more insulin, but there are a lot of islets which are in slumber, which are not actually dead. So those few cells, even if you can push them to come back to reality and produce insulin, we can reduce the need for insulin, we can delay the need for insulin. We may not be able to cure diabetes or anything, but pancreatin is such a remedy. So these are the things which can be followed by any other systems of medicine. I sincerely request all professionals to keep using them, trying them, how they work out, and probably add more new ideas to our practice. Then you have TSH, which is not responding even when the T3, T4 is very low, and the pituitary doesn't act to make more thyroid stimulating hormone, you can have a look at pituitary 6C, and we can have progesterone 6C wherever the endometrium thickness is less, it is not viable for conception. Probably in the first 2 weeks post period, you can always try progesterone 6C, and you can give the same medicine in a higher potency, the 1000 potency, which will regulate the release of progesterone, and especially in women at menopause due to fibroid uterites, intramural fibroids, or where there is thickness of endometrium, there is a reduction of blood circulation to the area, and they will bleed less, and there will be less menorrhagia with progesterone 1M. And we have with testosterone 1000 CE and 6C also. For example, in patients of benign prostatic hypertrophy, where the volume of the gland is the reason, and there is an increase in the estrogen which gets converted later into testosterone and causes more increase in the size. You can always try uforinum made from the same hormone in a higher potency, testosterone in a higher potency, to prevent the conversion and see that further increase in the size of the gland is prevented. So we have thyroidinum done. नहीं सर, मैं क्या बोल रहा हूँ, ये सब कुछ सबको करना है, सब अपने हाथ से करना है.
Sometimes it's too costly. We are not, somebody is not having progesterone supplements. You can always.
Yeah, and they are available online. They are available at any local homeopath. So please incorporate these things into your practice. I am sure integrative medicine will be richer with homeopathy as a partner on the table. Thank you so much.
It's a lot, I think, Acha, he wants to announce something which is very, very.
Well, we are all sitting here expert in our own ways. Let's make things happen and let's take it to the world. I am starting a full-fledged integrated hospital in Goa. And whatever support you can create will be welcome. And this, I think next 6 months or so, it should happen. Thank you, sir. Thank you, sir.
Hey, come on, thanks. Dr. Dinesh Kumar, ex-NI and Deputy Director.
Thank you. But it is a late evening. I think everybody is tired, looks to. But I want to make you awake by telling only 2 stories. One is the story which I have studied from International Journal, on which my research work and my awards have been gained. This story is Bratton et al., who was the scientist. He was a forest ranger. Because I was doing a lot of work on lead toxicity, heavy metal toxicity, and though I was a pharmacologist, my first job was to find out how the drugs are used in the medicines, not drugs. Medicines are used by the population. I did that work in ICMR. I was selected for that, to calculate the salary structure on how much the money is spent on each prescription, where my calculations were 10 rupees. 1 year, 5 episodes, 4 family members. So we have to add the salary to the salary person. After completing this job, I was surprised that this work which I have done has been carried away by many newspapers, as well as in the India Today 1986 part 2. Still I remember, that was the day. From there I have not seen my career back. It was just going on. So then I asked my director, Madam, now my job is over. I am a specialist in doing the animal experiments, not specialist in clinical. No, you read organ-directed toxicity or do work on lead toxicity. In 1986, nobody used to care environmental toxicity. I said, Madam, ये क्या काम दे रहे मेरे को? मेरा जिंदगी बनाना है, मैं ये environment में क्या काम करूँगा? I am very honest about it, sir. Madam said, आपका मर्जी, you can. Then I have almost resigned my job from NI. Then I have been put to counseling. In the counseling, one pathologist, Dr. Shashikaran, has told me, this is the future, this is how you will have to work on. Then there used to be scientific advisory committee, group meetings. In one of the group meeting, one director said, you please try how the lead toxicity can be reduced by supplementing the thiamine. Sir, it is a what we call mad idea. अरे director लोग यहाँ कुछ काम नहीं करते हैं ऐसे. I was very young. Then, okay, you first go and read the papers. In toxicology, the paper was on Bratton et al. Sir, how we have to take the concept from the story. He used to maintain a deer park. And all the deer, they used to develop a typical type of neurological phenomenon, where it used to be like a beriberi syndrome, and it was a typical neurological phenomenon, beriberi type of syndrome. And this Bratton used to supplement thiamine to this deer. Hundreds of deer used to be in the park. And he always used to do every 6 months this therapy, but deer never used to come to normal stage. Then somebody suggested, sir, why don't you get that grass tested for the heavy metal presence. In the grass, there was a heavy amount of lead and mercury which was coming from the nearby industry. And these animals used to take the grass, and he treated with EDT and with thiamine. And that is how the thiamine has come to an existence, that it is a weak chelator. Then I have taken that study